A new record-breaking tally of coronavirus cases has been reached in France. Over 208,000 new infections were identified. That's an increase from yesterday, which was also a record high. Let's take a listen to the Health Minister Olivier Véran.
Les chiffres qui seront publiés ce soir par Santé publique France.
The numbers which have been published by the French Health Ministry demonstrate the continual increase in the number of cases in the country. These are numbers that make your head spin. There are 208,000 French who have been diagnosed positive over the past 24 hours. Before coming here, I did a quick calculation. It means that in 24 hours, every second, 2 people tested positive for coronavirus.
We can cross now to our foreign editor, Armen Georgian, who is following the news here in France and indeed around the world with this coronavirus pandemic and those rising numbers. Armen, some alarming statistics, I suppose, being announced by Olivier Véran today, certainly the highest numbers we've seen so far in the pandemic. What more can you tell us about what he's been saying?
Well, essentially, he was using these figures to sound the alarm and to justify the government's plans for a vaccine pass, which it wants to bring into effect on January the 15th. So Olivier Véran, the health minister, he went up before MPs this afternoon for a question and answer session about how this vaccine pass would work. There were various amendments tabled. But it seems as though history is repeating itself. So you remember that before this idea of a vaccine pass came along, there was already a health pass in France, which was required for access to bars, restaurants, long-distance trains, and so forth. That was justified as part of an ongoing health emergency. It was rushed through, according to critics, through both chambers of Parliament. And it seems that something similar is going to happen this time with the lower house voting next week, as I understand. And then the law goes to the upper house of Parliament with perhaps the vaccine pass coming into force, therefore, on January the 15th. The essential difference between the vaccine pass and the existing health pass, which we have in France at the moment, is that with the vaccine pass, it will no longer be acceptable to do simply a negative test and to show that at an entry to a cafe, a bar, a restaurant, and so forth. People will actually have to prove that they have been vaccinated. So it's a really tightening of the screws in a way on the unvaccinated, or as the government would say, encouraging the unvaccinated to get vaccinated. So that is where things stand at the moment, possible coming into force, therefore, of the vaccine pass on January the 15th.
Indeed, and the health pass there was already quite a degree of pushback against it, so we can imagine that there might be some pushback against this too, seeing as you say, it tightens the screw. And Armen, the government hasn't ruled out further restrictions in January on top of this vaccine pass. Tell us some more about that.
Well, the health minister said that French health authorities were closely watching what is happening in Britain, because one thing that we've seen over the last almost 2 years of this pandemic now is that Britain is slightly ahead of what happens in France. So generally, one can make some deductions from what happens in the UK. It will probably happen in France a few weeks later. So why is everyone watching Britain? It's because people are trying to ascertain what is the impact of Omicron, this new variant, on hospital capacity, intensive care units in Britain, and so forth. That will be a clue as to whether hospitals are likely to be overwhelmed in France or not, given that, of course, what scientists have been saying is that Omicron is less mild than Delta, but more contagious. But set against that, James, you also have to remember that Delta is still present in France. So there's these two variants, Delta and Omicron, which are, of course, putting the hospital system under strain. So, yes, indeed, when Olivier Véran, the health minister, was asked about this, he said, of course, we can't rule out further restrictions, but his kind of spin, if you will, on this vaccine pass is that that he says he hopes that the vaccine pass will allow France to keep things open, in contrast to what's happened in some of France's neighboring countries, the Netherlands, Belgium, he also mentioned Austria and Denmark. In all of those places, there are already have been restrictions put in that are more onerous than restrictions in France. So Olivier Véran saying that he hopes this vaccine pass will allow establishments like cafes, bars, discos, and so forth to remain open. But of course, one thing we've learned from the last 18 months or more, James, is that the goalposts could move at any time, at any moment. So we'll have to really see what the impact of Omicron is on intensive care units and hospitals during the month of January to see whether the government will decide, despite the vaccine pass, to bring in extra restrictions. That, of course, can never be ruled out completely.
Right. Indeed, we know that there won't be a curfew for the 31st of December, but I suppose we'll have to wait and see if further measures are brought in later on. Armen Georgian, thank you so much for that analysis.
Thank you.